Imagine waking up in the 14th century with a throbbing toothache. No painkillers, no modern dentistry, just the terrifying prospect of visiting the barber surgeon. This is the story of how people endured dental care when every treatment felt like torture. In medieval Europe, your dentist was the same man who cut your hair and performed bloodletting. Barber surgeons were medical jacks of all trades, learning their craft through gruesome apprenticeships rather than formal education. Their dental toolkit would terrify any modern patient. The dreaded dental key, an instrument that looked more like a torture device than a medical tool. The pelican forceps, named for their resemblance to a bird's beak. And the simple, brutal hammer and chisel for breaking stubborn teeth. Patients would be held down by assistants while the barber surgeon worked. There was no concept of sterilization. The same tools moved from mouth to mouth, often carrying infection from one patient to the next. Tooth extraction was a public spectacle. Crowds would gather to watch the barber surgeon at work. The patient would be given ale or wine for courage, but nothing that could truly numb the agony to come. The dental key operation was particularly brutal. The claw would be placed around the diseased tooth, then the operator would twist and pull with all his might. Often, the tooth would break, or worse, the jaw would fracture. Survival rates were shockingly low. Historians estimate that 1 in 5 dental extractions led to fatal infections. Blood poisoning, gangrene, and lockjaw were common causes of death following dental work. Why did medieval people suffer so many dental problems? Their diet rich in coarse bread, ground down teeth. Sugar was becoming increasingly available to the wealthy, creating perfect conditions for decay. The prevailing theory involved tooth worms. People believed tiny worms burrowed into teeth, causing the characteristic pain of tooth decay. Treatments focused on smoking out or poisoning these imaginary creatures. Medieval cures ranged from bizarre to downright dangerous. Some practitioners recommended rubbing a roasted mouse on the gums. Others suggested holding a candle in the mouth to melt the worms. Urine was a popular mouthwash, believed to have cleansing properties. When the pain became unbearable, medieval people turned to dangerous alternatives. The sleeping sponge soaked in opium, henbane, and mandrake root could render a patient unconscious if it didn't kill them first. Alcohol was the most common anesthetic. Patients would drink themselves into a stupor before procedures, but this often made things worse. Drunk patients moved unpredictably, causing the barber surgeon to slip with his tools. For the poorest patients, there was only one option: the knockout blow. A swift strike to the head with a wooden mallet rendered the patient unconscious. Many never woke up or suffered permanent brain damage. Tooth decay wasn't the only dental problem. Periodontal disease was rampant, with many adults losing all their teeth by age 40. Ill-fitting dentures made from animal teeth or ivory caused constant pain and infection. Barber surgeons also attempted fillings using materials like lead, wax, or even crushed bones. These temporary solutions often caused more problems than they solved, trapping decay beneath the surface. For the wealthy, there was the option of tooth transplanting, having a poor person's healthy tooth wired into their jaw. The success rate was virtually zero, and the procedure often killed both donor and recipient through infection. Change began in the 18th century with pioneers like Pierre Fauchard, who invented new instruments and condemned the brutal practices of barber surgeons. His book, The Surgeon Dentist, laid the foundation for modern dentistry. The invention of anesthesia in the 19th century finally ended the era of painful dentistry. The development of sterilization techniques and understanding of germ theory transformed dental care from butchery to science. Today, we owe our relatively pain-free dental experiences to these medical pioneers. The horrors of medieval dentistry served as a powerful motivation for developing better, safer, and more humane treatments. The next time you sit in a modern dental chair, remember the centuries of suffering that made this comfort possible. The story of dentistry is one of slow, painful progress, from superstition to science, from agony to relief. Those medieval patients who endured the hammer and pliers paved the way for our modern dental care. Their suffering, though terrible, ultimately contributed to medical knowledge that would benefit generations to come.